So you may be having a persistent irritation down there on the privates, or maybe some UTI that keeps coming back and won't leave you alone. Or perhaps, just maybe, everything is just fine. Peachy King, no pun intended. But you're looking to bring down the skincare a notch or two and wondering what can you throw away out of this very elaborate skincare routine you use. Dr. Yuval Bibi, dermatologist, mission break you out of the skincare matrix of ridiculousness and help you row your boat to safe shores. Here are the very basics of women's intimate care, otherwise known as vulvar care or female genital care. This approach may shock you, but keep in mind, skincare culture, including intimate care, is rooted in the assumption that your skin doesn't know what the hell it's doing, that it must have skincare products or intimate care products to function properly. That is, of course, complete nonsense. More than 94% of people's skins function far better without skincare at all, and those who do need some sort of skincare need it because of damage created by a previous use of a skincare product. Number one, cleaning is for kitchen counters and floors, not for genitals. Your skin, including the skin of the vulva, is a miracle. Either evolution or creation, whatever it is that you believe, it doesn't matter. The skin functions beautifully on its own and is absolutely not dirty. Not only does it not need to be cleansed, but cleansing of the vulva, like any other part of the skin, by the way, with soaps or other cleansing products, intimate cleansers of sorts, immediately harms the skin by stripping off the upper layers, leaving it more sensitive, more vulnerable to irritation, and possibly even infection. Lukewarm water or cold water is perfectly fine. There's no need for soap, shower gel, body washes, or God forbid, intimate washes. Number two, scrubbing is for pots and pans, not the genitals. Scrubbing is cleansing much uglier, sister. Completely nonsensical, and no, you don't need to get rid of those dead skin cells. The skin does that all by itself 24/7 and for free. And those practices of scrubbing and scratching the skin systematically and consistently actually upset the skin terribly and make it much more irritable. This is absolutely horrible anywhere on the skin, let alone on the privates. Number three, dry vulva. Be very picky how you moisturize. Most moisturizers, including most intimate moisturizers, are absolute garbage. They're water-based products, which means they must contain a few categories of inactive ingredients to keep the product together while delivering no value to you, in fact, putting you at risk of irritation. Those categories include preservatives, emulsifiers, often colorants or dyes, and fragrance ingredients that are thrown in the product to make it more pleasurable to use, providing no moisturizing value to you and potentially irritating your skin as well as creating other skin issues. If your vulva is dry, use only oil-based thick products with as few ingredients as possible, as in 3 or less ingredients. Petroleum jelly, if you want to go for the cheap seats, or if you want to go luxurious, consider Butter Oasis Moisturizing Balm made with 3 ingredients, shea butter, cocoa butter, and argan oil, or Butter Blossom made with shea butter and sunflower oil. Number 4, itching, burning, or pain. Do yourself a favor and stay away from the over-the-counter medicated products. Itch relief is not a thing. Itch is a mere symptom that could represent a variety of different problems, all of which require very different solutions. Merely treating the itch is putting on a band-aid on the problem, and this band-aid could actually backfire in the form of irritation while making you ignore a problem that is getting worse and worse as you're ignoring the real cause. Your best bet, if you're experiencing any persistent symptoms on the vulva, is to see a board-certified dermatologist to diagnose and manage the problem appropriately. Take the guesswork out of the equation. Number 5, categorically stay away from anything labeled as intimate care. 99% of these products are really regular skincare products that were rebranded and relabeled as intimate care. The term intimate care is really just a marketing ploy to give you the confidence to pick up the product, pay for it, and use it as if it was designed for the privates. This is absolutely nonsense. In close to 100% of the cases, these are regular skincare products that were merely repurposed to serve a marketing need rather than the real biological one. Don't buy it figuratively and literally. Let me know in the comments section how this video saved you time and money. Also, don't forget to share, like, and subscribe for more no BS skincare advice. See you next time. God bless.